warm welcome to my show. I'm Dr. Bhoomika Banerjee and I have Dr. Shakti Singh with me today again, and he's joining me for a very special cause today. Isn't it, Dr. Shakti?
Yeah, ma'am.
So today's podcast topic is actually an NGO, which is very favorite to you also, right? So what is this NGO name and why you actually wanted to do this?
So this is an Asian Head and Neck Cancer Foundation. This is an NGO which is registered in Jodhpur. So
Okay.
as we had talked that my heart belongs to the Jodhpur. So every good thing happens in the Jodhpur. So
Great.
this is the NGO we started around 9 years back.
Okay.
It is established registered in Jodhpur.
Okay.
And the basic aim of the NGO is to make people aware about the cancer,
Okay.
especially the oral cancer,
Right.
because oral cancer or head neck cancer is the most prevalent cancer in today's time,
Right.
and the data shows in next 10 years it is not going to come down.
It's going to increase.
It is
We'll
going to
get more
increase.
patients.
The patients are increasing day by day. Second important factor is these patients are reported very late to the doctor.
Okay.
As we have spoken or discussed earlier, that these patients who have the small ulcer or lesions, they do not come to us. They will self-medicate.
Yeah.
They'll go to nearby doctors till the time it interferes with their activity. जब तक वो उनके काम करने में अड़ेगा नहीं, तब तक वो डॉक्टर के पास नहीं आते.
True.
So patient awareness is very, very important.
Very important.
So we work on both patient awareness as well as doctor's awareness. Because we live in a geographical isolation.
Yeah.
So the doctors, the availability of cancer surgeons, for example, in Jaisalmer and Badmer is not possible. There are no cancer surgeons.
Right.
So how do we diagnose these patients?
True.
How do they go to, for every small thing, do they have to travel to Jodhpur or Ahmedabad for the diagnosis? No.
No.
We need to empower people.
True.
We need to empower dental surgeons. We need to empower the medical officers. We need to empower the specialty of medical branches.
Yeah.
That these patients are diagnosed on an early disease.
Yeah. And that's what we have already discussed. Early detection.
Early detection is the key.
Is the key. Especially in cancer.
Especially in cancer. So when I stepped into the oncology, the first thing which came to my mind, that my father used to say, you should always give back to society what society has given you.
Right.
The day you become that much competent, the day you become a competent, start giving to the society in whatever best possible ways. Right. And he has given a beautiful example. He said when he was in a Sikh regiment, he was in army in a Sikh regiment. Every Sikh used to donate some amount to their capacity. He said it can be 5 rupees, it can be 50 rupees, it can be 500 rupees. But everyone used to donate it. It's not that when you earn 1000 rupees, then only you will donate 50 rupees. No. So I didn't wanted to start an NGO at the age of 60, 70 when I'm done with my life, and then I'll say okay, I'm doing something for the people.
True.
So the day I became competent to my field, I, along with my other friends and colleagues, we started this concept of started this NGO, which is dedicated towards the cancer awareness, and that is Asian Head and Neck Cancer Foundation.
So how this idea actually generated, like who were the people, who are part of this organization, and how, what was the first thing that you did? So we want to know.
Yeah, so as I said, we have discussed when I was in Jodhpur, I can see the pain, the problem which was there in the society about the awareness of cancer. And I knew it that one person cannot make changes.
We need to team up.
We need to team up
with like-minded people.
So then I discussed this thought with my friends, with
Hmm.
dental friends, with my medical friends, and we said
Hmm.
ki we should start a NGO which serve the people.
Hmm.
Because as a doctor, it is difficult to do service while you are associated with the hospital.
True.
So we wanted to have both separate entity.
Okay.
As a doctor, I'm totally separate thing, but as an NGO, yes, I'm totally a separate entity. And we wanted this entity to reach to the masses.
Hmm.
We wanted this entity to help maximum number of people. They can take help of it.
Right.
We kept the name as Asian. So many people have asked me,
Yeah. Why Asian?
why Asian?
Hmm.
See, whenever a thought when this thought came to my mind, I always knew this problem is not only in our country.
Hmm.
This problem is with the whole Asian continent.
Okay.
Be it Bangladesh, be it Sri Lanka, be it Nepal, be it Pakistan, all the continent, they have the oral cancer prevalence is very high.
Right.
And as it is as a part of humanity, we need to spread this concept, this awareness among other people also.
Very true.
So I wanted to make an entity which works in the whole Asian continent. So my dream is that we will be have working in all these adjacent countries as a part of humanity. And that is
That's
where the Asian word came, because I want to tell the Westerns, I want to tell the Europeans that we are also doing work for our people. So this is where the
it's
Asian
not just
came.
confined to India. Let me clarify
Yeah,
that,
it's
right?
not confined to
So
India.
it is international,
Yes,
because it is Asian,
Right,
right?
right.
So your work is spread across the entire Asian continent.
Yes.
Right?
We already started our working in Bangladesh. We have conducted a lot of training courses in Bangladesh. We have the coordinators, we have the people in charge in other countries like in Nepal, in Bangladesh, in Malaysia, Philippines, and Sri Lanka, and yeah, of course, even in Pakistan also we have the people who are coordinating for our work. Because when it comes to the cancer, when it comes to a life, I think we need to think beyond borders and save people.
Very true. We need to unite, because we are
Yes.
talking about humanity.
Yes.
We are not talking about borders. We are
Yes.
talking about saving life. So whenever it's humanity, I don't think so there has to be a boundary.
No boundaries for humanity.
It's boundaryless, because
Yes.
it's as a whole we are talking about. We are talking about the world. And of course, if you have started as Asian, there are possibility you might expand in future. It will reach to the world,
Yes.
right? Because I think any effort, there is always a beginning point, and you grow slowly with it, and then you spread
Yes.
in the masses. Okay, coming back to the foundation or the core of this foundation. So I want to know, what kind of people are associated. Is it the medical fraternity mostly? Yeah, yeah. Most of the people who are there as a part. How do you define them?
So we have people from medical fraternity, from oncology fraternity, from dental fraternity. We have lawyers. We have the patients who have been won the fight against this cancer.
Okay.
So it's a very mixture of the social workers. So we have mixture of patients, mixture of people in the foundation.
Wow.
So
So
even
everyone is part of your
is a part of
foundation,
foundation, yes.
right? Even the patient.
Yes.
Like that's very, that's a piece of information which creates an awareness that even that is possible. Like,
Yes.
if you're forming a group, there is
Yes.
no, there's no bifurcation of like whom to choose, whom not. So even patients are coming along.
Patients are coming
So
along.
are they patients, like they do this initiative? They ask you that we want to
No,
be a part of
we
it.
approach them because see, when it comes to cancer, we want our patients to help us in fighting against this cancer, and
Right.
we offer to the patient that would you like to work with us, and it's a voluntarily work.
Yeah, it's voluntary.
It's a voluntary.
Of course.
Nobody in the NGO is paid for doing this work.
Right. It's a
So all the
volunteering
people who are
process.
the core group members, nobody is taking any salary out of it. Everyone is working out of voluntarily. So these
Okay.
patients have given an option that whether you want to associate with us and carry forward the work which we want to do it.
Right.
So patients have taken ki yes, if I can win, everyone can win. So I will take forward this work and I will go and tell the people. So
Right.
that's how your infiltration or your the message to the community, to the society becomes more stronger when a patient stands up
And
and he
talks about
talks
it.
about the cancer.
Yeah.
So that is the reason that I specifically wanted to take few patients who really motivated and who can you can change the mindset of the people who have a fear of diagnosed with a cancer, or who has a fear of having a second cancer. So they are the people who motivate them
Okay.
to go for the right time, right treatment, right people.
Very rightly said, Dr. Shakti. So coming on to the foundation. So when did you start this journey? Like when was it established, and what all works you have done so far? Is there any particular project that you would like to mention here in our podcast?
Yes, so this has been established in 2017. This is registered at Jodhpur, and we have been actively working on this foundation since then. And we have a lot of projects running down in today's date also. We have a lot of projects running down for, like, we have educational activities, we have mass awareness activities, we have conferences, we have academic events, we have training programs. So a lot of activities are going on. So let me start with the educational activities.
Right.
So when we have uh, analyzed that why these patients are reporting late to us, we have interesting finding. We had that even our dental colleagues at times have ignored the pre-cancer symptom or cancer symptoms in the early stage.
Lack of awareness.
Lack of awareness in the dental fraternity.
The dental fraternity, right?
So this I have discussed with my boss, Dr. S.V. Kumarsamy, and I said, sir, what should be done for this? And he said, you have catch the right nerve. So before you do anything, first educate your people, because I belong to the family of dentistry. So he said it is your responsibility to train the dental fraternity.
Very true.
So then we started a program by name EduCan, that is Education for Cancer for Dental Professionals.
Okay, so what does it spells like? EDU?
EduCan.
So EduCan.
Education for Cancer. EduCan.
Right. So the initial words from both the words.
Initial words, right? From alphabet from both the words.
Like EDU from education and CN from the cancer.
So EduCan has been started at the time of COVID, and definitely mentored by my boss. And then we started at that time the digital network, the Zoom concept was coming up.
Okay,
the Zoom meetings,
Zoom
meetings. So we started this program with a online sessions.
Okay.
So at least we transfer the knowledge about the awareness of this program to the dental colleagues.
Right.
We didn't want it to limit to one particular city. We wanted to spread to the whole country.
Right. Right.
So we started with the online training programs. We ran this program for almost 4 years. And then we have modified this program with the EduCan 2.0.
Okay.
Then we added offline training also.
Okay.
So now we have 6-7 offline training centers. Like we have in Ahmedabad, Jaipur, Udaipur, Mumbai, various offline centers are there, wherein the people have been trained. Now they come for the training, hands-on training. Because whatever we have taught them in online program, they will teach them in the hands-on also. That how this patient been diagnosed, how you use the technology, how laser can be used, how you should handle this patient, what are the difficulties these patients they have, how your role is going to change their quality of life. So all these things we teach in a workshops. So what we have done, we have educated people and we have given a training also. So giving this, we have trained almost around 1,000+ dentists across the country.
Okay. So far you have achieved that figure of 1,000+ dentists.
1,000+ dentists in last 4 years. Yes.
That's quite an achievement.
And then we started this program as well in the other countries. Because we have the international faculty from all these countries. So we started this training program even in Bangladesh, even in Nepal. So the people from these countries, they participate in the education program, and then we conduct hands-on workshop in all these countries.
Very nice.
So that is how the training of dentists is happening, and actually that is leading to early diagnosis of the cancers in the patient.
Yeah, because they are the team of doctors, the dentists, who can actually help in early detection.
Correct.
Right?
See, suppose I give you an example that suppose somebody is in Jaisalmer, he gets in some difficulty or he gets something in oral cavity. He can easily go to a nearby clinic, get his checkup done by dentists who have been trained by us. He doesn't have to travel to me.
True.
So when I say education, that patient will get right information from that particular dentist.
Absolutely.
If he has any doubt, he can anytime connect to our network. Because now, as I said, we live in a digital era, right?
Yes.
Any information that can be sent to us, our team of doctors are available to guide the patient.
Yes.
So in that scenario, the chances of late detection will come down. And that is the best service we can do for the society. Absolutely. So this education program is been one of the successful program which we are running down along with the workshop centers.
Okay.
This is the one of the program we have.
Great. So apart from this, what else? You have mentioned couple of things that, as an Asian head neck cancer, the society that you formed, like it's an NGO, right?
Right.
What else you do other than this?
So what we do is we work on educating them, and then we associate with them.
Okay.
So right now, like the next program we take them into is ECAN clinics.
Okay.
That is early detection clinics.
Okay.
E stands for early detection, E stands for empowerment of dental professional, and E stands for e-health services, or that is telemedicine services.
Okay.
Now what is happening is, suppose one of the dentists we have educated in Badmer. What we have done, that all these people who have collaborated with us, right now we have around 50 plus clinics network in Rajasthan and Gujarat.
Okay.
All these 50 people are offering free cancer screening.
Okay.
Anyone, we have 5 clinics in Jodhpur.
Okay.
Right.
We have already established.
We have already established. There are 5 clinics are there, and we are planning to make it 50 clinics in western part of Rajasthan in next 6 months.
Okay.
Anyone can walk into these clinics and get their cancer screening done.
And that too free of cost.
That too free of cost. As a foundation is going to pay their consultation charges, because a dentist is not working for free.
Absolutely. That's what my next question was, and you answered it already.
He is not working for the free.
That although you are saying it's for free, the charges are being borne by the foundation.
Borne by the foundation.
Right. And you people are arranging it after you collaborate with that particular clinic.
Yes.
Right? That's how you are working.
That's how we work. So now every dentist is empowered to do the early detection.
Right.
Empowered to manage these cancer patients. Empowered to do the follow-up of these patients. Because see, what happens is, patient get surgery done from distant places, like for example from Jodhpur or maybe Jaipur or Ahmedabad. When they get back to their place, see, they don't come for the regular follow-ups.
Right. राइट एब्सोल्युटली. तो ये चीज मैं हिंदी में भी एक बार बोलना चाहूंगी, क्योंकि हमारे बहुत सारे व्यूअर्स हैं जो हिंदी से बहुत चाहेंगे कि हम उसको बोले. तो डॉक्टर ये कह रहे हैं कि इनका जो ये एफर्ट है, इनका जो फाउंडेशन है, वो क्लिनिक्स, लोकल क्लिनिक्स, डेंटल क्लिनिक्स के साथ मिलके काम करते हैं, और फ्री स्क्रीनिंग, कैंसर, ओरल कैंसर के फ्री स्क्रीनिंग्स का एक अपॉर्चुनिटी आप दे रहे हैं.
यस, टू जनरल पब्लिक. एनीवन कैन वॉक इनटू देयर क्लिनिक, और कोई भी उनके क्लिनिक में जाए, उनके वहां बोर्ड लगा रहता है जिनके साथ मैं कोलैबोरेट किया है. जी. और वो उनके पास जाके अब बोले कि मुझे कैंसर स्क्रीनिंग करानी है, they can sit, get their cancer screening, they will give a certificate whether they have got any problem or not. अगर उनको किसी में प्रॉब्लम है सो दे डू द फॉलो अप. वो डेंटिस्ट जो है वो उनको टाइम टू टाइम चेक करने के लिए हमारे लिंक के थ्रू वापस उनको बुलाता है. अच्छा. दैट इंफॉर्मेशन इज पास्ड ऑन टू अवर एनजीओ. नाउ वी स्ट्रेटिफाई हाई रिस्क, इंटरमीडिएट रिस्क और लो रिस्क. तो बेस्ड ऑन जो डेंटिस्ट ने इंफॉर्मेशन हमको दी है उसके हिसाब से स्ट्रेटिफाई करते हैं. एंड डेंटिस्ट को हम लोग वापस वी टेल द पेशेंट टू टेक द फॉलो अप एवरी 2-3 months. वेदर जो उसका छाला है या जो उसका वाइट पैच है उतना ही है, बढ़ रहा है, कम हो रहा है. सो वी टेल द पेशेंट, वी प्रेशराइज द पेशेंट टू टेक द फॉलो. अगर मान लो बढ़ रहा है तो वी आस्क फॉर द ट्रीटमेंट, बिकॉज एज आई सेड पेशेंट विल नॉट गो फॉर ट्रीटमेंट जब तक उसको दर्द नहीं हो रहा है.
सही बात है. जब तक उसको उस चीज की पीड़ा नहीं होगी
तब तक वो ट्रीटमेंट नहीं लेगा. उसको लेगा
नहीं जाएगा ना,
वो डॉक्टर के पास भी नहीं जाएगा. और डॉक्टर अगर बोलेगा तो भी he will not get convinced.
Yeah.
He will think कि why he wants, जब मुझे कोई दर्द नहीं है, तकलीफ नहीं है तो क्यों करना है. But we cannot realize, we cannot wait for the cancer to happen and then he's come to the cancer.
तो ऐसे केसेस को बहुत स्पेसिफिकली हैंडल किया जाता है,
उनको फॉलो अप किया जाता है
ऑर्गेनाइजेशन के चैनल के थ्रू. तो बेसिकली ऐसे केसेस को राइट आप लोग स्पेशली फॉलोअप्स देते हैं, बट ये सारा कुछ ऑर्गेनाइज आपकी एनजीओ कर रही होती है.
बैकएंड से एनजीओ करता है कि एवरी डेंटल क्लिनिक पे वो पेशेंट जाए और फॉलो अप ले. एंड दिस हाउ वी आर एम्पावरिंग द डेंटिस्ट आल्सो. राइट. See, a dentist is empowered कि everyone in the vicinity knows it कि dentist is trained for cancer screening. Right. Usually लोगों के अंदर क्या perception होता है कि यार how dentist को क्या पता कैंसर क्या होता है.
Very true.
Why dentist is talking about cancer? ये मुझे डरा तो नहीं रहा है. And dentist is also of an opinion कि मैं इनको बोलूंगा कैंसर है तो पेशेंट भाग जाएगा. It's a loss for the dentist.
Very sensitive issue. It's a very sensitive issue. So we need to handle it that way.
Yes. So a dentist is being trained how to handle it.
Such cases. Such
patients.
So if it reaches the dentist, then you people at the back end help the dentist also as well as the patient to manage it basically.
For diagnosis,
right?
If patient is diagnosed, then dentist gives them an option. That see, if you want to go to this hospital, now the cancer treatment. First of all, I would like to say that cancer treatment it's become free for all. With the Ayushman card and with the PMJ Yojana.
Absolutely.
So the financial hurdle has gone down.
Absolutely.
It disappeared, but still. Now this is a mental hurdle. I think we spoke the last time also.
Yeah, of course.
This is a mental hurdle which patient doesn't want to get the treatment done.
Yes.
So
we need to motivate the patient.
Motivate the patient
from various channels.
So from there, dentist gives them an option to get the treatment done from nearby centers, wherever they want to get it done. But after the treatment is done, after treatment, patient should come back to the dentist for follow-up. That circle should get completed.
Yeah, and your NGO makes sure that the entire cycle is.
We are helping these patients in completing that circle.
Correct, and that is very much important. That is very much required also. Why? Because it's a team effort.
Right.
It's a teamwork. Maybe that dentist cannot do it alone.
Right.
But when that dentist takes the training from your organization,
and they're empowered to do that.
They're empowered to do it. They are associated to you. At least he has someone to fall back upon. And of course, when he is treating that particular patient, as you said, that the patient is going to come for follow-ups as per the designated dates.
Yes.
If there is a possibility that there can be something. But we are not saying that it is cancerous, but there is a possibility or a probability that it might turn into a cancer.
Correct.
So you people make sure that the proper follow-ups are done.
Yes, that is what the difference between the Western countries and our country.
Right.
See, our country follow-ups are very poor.
Very true.
एक बार पेशेंट ठीक होता है उसको लगता है आई एम ऑल गुड नाउ, मुझे कहीं जाने की जरूरत नहीं है.
तो फॉलोअप्स क्या है हिंदी में देखा जाए?
फॉलोअप का मतलब है कि एक बार इलाज होने के बाद में आपको टाइमली पीरियडिकली डॉक्टर को बताना होता है.
हाँ, तो आपको
क्यों बताना
है डॉक्टर को?
सिर्फ डॉक्टर को बताना है. क्यों बताना होता है कि जब भी किसी को मुंह में सपोज इस गाल में कैंसर हुआ, ऑपरेट हो गया, सब कुछ हो गया, ही इज ऑल गुड, बट जब टबैको वगैरह खाते हैं ना, उसका असर तो पूरे मुंह में होता है.
बिल्कुल.
He has higher chances to develop on a tongue cancer, he has develop on other side of the गाल में हो सकता है.
मतलब दोबारा ना हो जाए ना, बेसिकली
तो
दोबारा
दोबारा कहीं पर शुरुआत हो, उससे पहले either dentist looks into it and then treatment can be done with the lasers then and there. He doesn't have to go for a major surgery. उसको कोई बड़ा ऑपरेशन करने की जरूरत नहीं पड़ती है. So इसलिए follow-ups are very very important.
Very very important.
And the idea behind starting this ECAN clinics is to enhance the follow-up of these cancer patients.
Right.
And when we say to a dentist, do the cancer screening, that doesn't mean that they have to look for cancer patients. We are looking for cancer screening. Even a healthy person, if he eats tobacco, if he has taken pan masala, gutka chewing, he can go for a screening. Right. So we want whether patient
anyone
has
can go for
anyone
screening.
Can go. So that's
just
what
to be
we
on
tell
safer
our
side, like how
yes.
we nowadays say is that कि आपको अपने रूटीन ब्लड टेस्ट कराते रहने चाहिए हर 3 से 4 महीने में. तो सिमिलरली ये रूटीन चेकअप्स होती हैं. स्क्रीनिंग मतलब चेकअप्स जो कि आपके नेटवर्क में जो डेंटिस्ट हैं
जिनको हमने ट्रेनिंग दी है, so these people do the follow-up checkups. इससे see western world में क्या है, in America, everyone have to go for the dental and oral health checkup yearly. Okay. It is a mandate.
Okay, it's
like how you file up the income tax.
Okay.
It's a mandate for them to get the oral health screening done.
Which is in a way good practice.
Which is in a way good
practice, kind of, right?
Today, tomorrow, I would wish that some government should take a step, because we have the highest number of dental surgeons across the globe. Our country
India,
has got highest number of dental surgeons.
That's good to know.
So it is as I said, these people can help us in diagnosis, prevention, follow-ups, and rehabilitation of these patients. So that's how we started with EduCan for dental professionals. Right. And we are in a pipeline. We are developing for EduCan HP. What's that? Education for cancer for health professionals. Okay. Earlier it was only for dental. Now we are getting it for health professionals. So what do you mean by health professional here? Who all are included in that category? Because वो थोड़ा specific होगा. Anyone who is related to health. Related to health. Anyone related to health. See, we are giving a training about how to detect oral cancer. What are symptoms of oral cancer? That's it. See, nobody is teaching you the treatment of cancer. Right. It is only about knowing signs and symptoms as a professional colleague. Okay. So every health professional, he can be a medical officer, MBBS, he can be BHMS, he can be homeopathic doctor, he can be nursing staff, he can physiotherapist. Any medical fraternity can get the training and guide the patient in the right direction. So this is organized by your NGO? Yes. So this we are going to start from 4th of Feb. Okay. That is the World Cancer Day. Wow. So that is the day we are starting. So that's an initiative. That is the initiative. Asian Head Neck Cancer Foundation. And second important thing. This EduCan HP is going to educate for all 3 cancers. That is for oral cancers, breast cancers, and cervical cancers. Oh, that's good to know that you have included other cancers. Other cancers as well. So a health professional should know basics about the cancer. Right. Be it a breast cancer, cervical cancer. At least he can talk right knowledge to the masses. Absolutely. What is happening in today's era is people are getting misguided by the people who are not professionally knowledgeable. They just take some matter from ChatGPT and they make a reel and make it put it on social media. People think that's the reality. These people are not educated enough. These people do not have the professional knowledge about it. Those who are talking about cancer in the social media. So do not get distracted, misguided. Right. by these so-called social media reels about cancer. So that is the reason that we want to make a network wherein we train people. We train people. Until unless you empower people, you train people, things are not going to change.
Very true.
So they have to go to the masses. See, and we don't want these people to work in the metro cities or big cities. People from, for an example, again I say from Falodi, people from Shergarh.
Tier 3 cities basically.
Yes.
You want to work
Even
from
the
there.
rural
Even the
areas,
rural
tehsil
areas.
level.
Even the rural
People
areas.
in tehsil level, they should get educated about it.
Absolutely.
They should disseminate the information of cancer to general masses.
Right.
And that's how we create a network. If a patient has a disease, then there are primary detection centers.
Yeah.
So from masses, they will come to primary detection centers. If still they feel there's a problem, then they come to a secondary diagnostic centers. If patient needs a treatment, they are referred back to tertiary treatment center. So that's how our network is going to work.
Right.
So we are making this Educan HP for all three cancers, and I'm very sure that whenever this comes in a full throttle, this is going to have a large impact on early diagnosis and prevention of cancer with giving the right information, with the validated information to the masses. So that is the two programs which are very close to my heart and which are interrelated. See, whenever we say about training, training is not about, you come online, you just take certificate and go. First of all, our training is certified by university.
Right.
So the certification is given by a Gujarat university about the Educant program. The collaboration, the people who do, we have a specific black and white MOU with them.
Oh.
It's not every dentist can come and associate with us.
Okay.
And do the screening. We work with the people whom we have trained it, educated it.
Right. So that is very important. You have to get associated with a proper channel.
Proper channel.
The proper channel is you are taking the training.
Yes.
Right.
Yes.
You're getting education, and only then you take it forward.
Correct.
Right.
So these are the basic mass awareness as well as early detection programs our foundation is doing.
That's really a very good thing that your organization is doing. And so what else other than this? We have talked about the education program that you're running, as well as you have been talking about the workshops, and I think there are a lot of conferences also that you do from time to time. So is there anything which is coming up in coming months?
Yeah, so we organize this International Congress on Dental Oncology.
Okay.
So this dental oncology conference is happening in whole Asian continent. We are the only people who organize this kind of conference.
Okay.
And I'm happy to share that in last conference, which has happened 3 months back.
Right.
We have the people, the faculty came from all these countries to participate in the conference. And we had the registration from all these countries for online registration. For our India, it was offline. Yeah. For other countries, it was online.
Online.
So this dental oncology conference is one of the bigger platform to educate these dental professionals on a mass level. The next conference we are going to organize in Mumbai, that is ICDR 2027, will be in Mumbai. So we'll be organizing every 2 yearly we organize this conference. So that is going to happen at Mumbai. So
you did that in 2025, right?
Yes, 2025
in Ahmedabad? Where
in
was
Udaipur.
In Udaipur, okay.
Yes. So next will be in Mumbai.
Mumbai, that will be in 2027.
Yes, so we do these conferences at, we have planned, our board members have planned to do this conference at multiple locations. Every year we'll have different location. Location will not be repeated.
Right.
So from Mumbai we might go to Bangalore or Delhi based on the volunteers we get for the organizing this conference.
Right.
So we usually work on the voluntary involvement more. So that's how we are going to organize this ICDR 2027 at Mumbai.
Very nice, and thanks for sharing this on our podcast.
Yeah.
Definitely, this is one of very, very important information which I think you have shared it with our platform. So moving forward, what is the as per the education is concerned, when we were talking about
Yeah.
here a few minutes back, the girl education is also something which you people are like, kind of a free education or something which you are encouraging through your NGO. Is there anything that you are doing on that also?
Okay, so our NGO is basically when we talk about sponsoring or helping people,
Hmm.
So what we have done is there were patients uh, who have fallen to the cancer,
Hmm.
So we support the girl member of their family in their
Okay.
education.
Which is so nice of
Yes,
of an
so
effort.
we have taken an initiative to uh, take their to provide them with their tuition fee, with books and bus fares and all for the families whose father is being succumbed to the cancer. So there
Hmm.
right now we have two people whom we have sponsored. We do small work, whatever has been possible.
Right.
But I think doing a small work is more important than not doing it.
Very true.
And
Very rightly said.
the wishes, the kind of when their family sit in front of us, the emotion they show is it's priceless,
It's
and that's
priceless.
what we experienced and we started this. I wish that we should collaborate with many more institutions like this, and
Right.
we can help these people
Hmm.
in any of the family. They have difficulty in providing education to girl child because of the some death due to cancer, because many people have mentally they get very disturbed with the cancer and loss of life. So I think that is very important, because I always feel that the girls are the future of the country, and when the girl education, girl empowerment is strengthened, the whole society perspective changes.
Very
That's what
right.
I realized in Gujarat. Gujarat,
Hmm.
the female empowerment is very nice,
Yeah.
and that's how the Gujarat is developing. So it's
Hmm.
very important for us also that we should work on female empowerment, but we are working from a different perspective. We are strengthening the female empowerment by providing support system to these families. We also, we help these girl child in my village.
Hmm.
We have a scholarship, a small amount of scholarship for the girl child,
Hmm.
those who want to get into medical field. So
Right.
we empower, we educate them about getting into medical field or nursing or physiotherapy or pharmacy field. But we would like these girls to get into the medical fraternity per se, because what's happening is still in today's time also, we have,
Hmm.
there's a lack of medical professionals
Very
or
true.
I can say the paramedicals are still, the numbers are very low
Very
against the
low.
population.
Yes.
I tell you a small example. 2 days back, one of the family who has been operated by us, and we asked them to go to the village.
Hmm.
So they said there's no female nursing staff to take care of us.
Imagine the kind of, you know, with the amount of work we all need to do in this particular
Particular field.
field. Yeah. So a lot of work needs to be done, and good that the NGOs are coming forward. Your NGO is doing a
Yes.
fantastic job. Even I have got associated with one of the NGOs we were discussing
Yes.
the backstage. So
Yeah.
we need to come together. I think all the intellectual people, this is a responsibility
Mm.
I feel has, that we need to work for the betterment of others or underprivileged.
Yes.
Right? Don't you think so?
Yeah, I agree with that, and we are looking for collaborations, collaborations and all these aspects. Wherein the ultimate aim is to help society, help people in whichever best way possible.
Absolutely, Dr. Shakti. And it's been such a pleasure to have you always on our podcast show, because this is even our agenda is all about that. We want to spread awareness. Yeah, we want to spread that, the good awareness, I would say. Like with you, it's always about
Yes.
cancer, it's about the awareness on oral cancers. But yes, of course, there are so many things, especially if we talk about girl education. That is also a topic which is a very, very vast topic.
Yeah.
But your contribution is really, really valuable.
Thank you, ma'am.
So, Dr. Shakti, what are the other training programs that you are going to offer in future, especially related to oncology? So, you can please tell us about it.
Yeah, ma'am. So we have two training programs right now with our foundation. So one training program it's a 2-year fellowship program,
Okay.
wherein we select the candidate. They have to work with us for 2 years, continuously in the hospital setup for 2 years, get the training, and then they start their own practice. So this is one of the 2 years training program in head neck cancer.
Okay.
The second training program in the field of oncology is we are starting with a diploma in microvascular reconstructive surgery.
Okay.
So this microvascular surgery, as I said, is play a very important role in quality of life.
Right.
And there are a handful of surgeons, especially in Rajasthan, across the country, who are conducting this kind of surgeries.
Great.
Now, because there are no training centers available, they're not able to get themselves trained into the field of oncology, this microvascular surgery. So there's a lacune. That's where we have realized, and then we have formulated a program by name Diploma in Microvascular Reconstructive Surgery.
And this is one of the offerings by your Asian Head Neck Cancer Foundation,
this is
right?
one of the initiative of Asian Head Neck Cancer Foundation, wherein we are going to teach people how to do microvascular reconstructive surgery. And it's a 6-month diploma course, wherein it is on a hybrid program. So we have the lectures online followed by offline training programs. So this will be offline training will be in laboratory models, wherein we have microscope, we have silicon arteries they can practice, and they will also get a chance to practice on the cadaveric dissections. So cadavers are I can say the dead bodies, So in medical training, these are cadavers are being used for training purpose. So these people will be taught how to do these surgeries on the cadaveric program. And the third module is on patient, working with us,
so just to
assisting with
mention,
us.
these dead bodies are unclaimed dead bodies, right? Which has
Yes,
which has
these
not
are
been claimed by any of the
unclaimed dead
families,
bodies, and now
that you use
and
for
also
the
there are many people now,
who donate.
who says that's okay, we have donated for the medical education.
Right.
So there are a lot of dead bodies now coming for donation also.
Right.
So this is a diploma program which we are going to start from the 1st April 2026, and the announcement soon after 2 days is going to happen. And the idea behind starting this program is not only to train people in our country, but it will be open for the world, because we have many people from other countries as well, even from Middle East, from Norway, from European countries also. They want to have a hands-on training,
Right.
because for them learning is it comes at a very late stage.
True.
So we will train them. Not only, as I said, not only training our people, but we will train the people across the globe. So I hope that this diploma should change the training programs which is happening right now in our country.
Definitely, Dr. Shakti, and thank you so much for sharing this on our platform. I think this is one of the best informations that we are spreading across via this program to our viewers, and wish you all the very best for these initiatives, and keep doing the good work, right?
Thank you.
So, Dr. Shakti, is there any book available on the dental oncology, the system which you are following? Is there any book which is available which can be a guide to all the dentists out there, or whoever wants to gain knowledge in this particular field?
So as of now, there was no book available on the subject of dental oncology. Because as I said, the dental oncology in whole Asian continent is in a very embryonic stage. There's probably less than 1% who are aware about what is dental oncology.
Right.
So we have taken this initiative to write a book.
Okay.
So I, Dr. Shakti, and my colleague Dr. Natasha, we have wrote a book on dental oncology. It's a handbook on dental oncology to spread the awareness of dental oncology to all these dental colleagues. And this book is available with us and also on the Amazon platform. So whosoever wants to order this book, we usually send a copy of the book to these people. So
Very
this is
nice.
a very unique book on dental oncology across the Asian continent.
That's so amazing to know that. And as you said that it is available in Amazon,
It's
right?
available
So
on
what
Amazon.
is the name of the book exactly? It is
It's a handbook on dental oncology.
by Dr. Shakti
Yeah,
Singh.
yeah.
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 Okay. So I think our viewers have noted it and they'll
Yes.
be able to get it on Amazon. And even if you want us to help you with that, you can write to us so that we can coordinate with Dr. Shakti's
Yes.
team and we can definitely help you with that. Thank
Yeah.
you so much,
Thank you,
Dr.
ma'am.
Shakti,
Thank
for
you.
spreading across so much of knowledge. It's such a learning for us as well. And keep doing this good work.
Yeah.
As a doctor, you are such a brilliant, I would say you have been traveling, you have been collecting knowledge, and you're not keeping that knowledge to yourself, you're spreading it across because that is also very important,
Right.
right? And you have this organization that we spoke about today. It is Asian Head Neck Cancer Foundation, which is formed by you and others, of course,
Yeah.
from the medical fraternity, and few
Yeah,
here.
my father,
Is the
Captain Ratan Singh
president?
Devra, is the founder and the president.
Okay, he's the
So,
founder of
he's the
founder of this particular
yes,
foundation.
and he's the idea behind starting the social service, as I mentioned earlier.
So he's the man behind you, I
Behind
would
me,
say.
yes, always he's behind me always.
So good to know that, Dr. Shakti, and we would like to do such podcasts more with you, because of course, spreading awareness is something also contributing to the nation in many ways.
Yeah.
So thanks for your time today,
Yeah,
and
thank you.
we will see you again shortly. And with that, I think we'll conclude this podcast today. We have talked so much about this organization or NGO, I would say, who is working so hard to spread awareness on oral cancer in many ways. So if you have any kind of feedback that you want to give us, we have our email ID in the description box. You can write to us and do tell us how do you like our show. And keep watching, subscribe our channel, and of course at the end I want to mention Alpha Nano, which has been produced by my banner, is now on the OTT platforms. You will find the details in the description, so please do watch it and spread the awareness. Thank you, doctor,
Thank
for
you, ma'am.
joining
Thank
us.
you. Thank you.